I would like to talk to you about models of understanding patients from simple through to complicated chronic cases. Having done this, you should get an understanding of how the components are necessary and how better to help people with chronic, especially with chronic injuries and illnesses. The first one I'd like to talk to you about is a mathematical type of analogy. So I presume most people have done maths at school, so we're going to do a little bit of a maths class here. The first type of patient is a very simple patient. So type 1, if I write x plus y equals z. Now let's say that a patient comes in with pain. So z is pain. And that pain in a certain area of the body is represented by z. The whiteboard that I'm writing on represents health. Okay? X and y represent the components I need to uncover through my assessment process. So in the case of a simple person, X might be a joint, so I'll just simplify joint, and Y might be a muscle, so I'll just write MM for muscle. So in this case, we have a muscle problem, for example, let's say it's the right quadratus lumborum, and a joint problem, let's say L3 dysfunction. They are together in trouble, which is creating low back pain. So that's a simple case. In this case, treatment would be relatively simple because we could massage the muscle and release the joint through articulation or manipulation. Okay? Incidentally, just on point 1, even if we didn't know what was going on, we could probably get away with doing a general treatment which addresses many joints and muscles and probably accidentally hit the problem and therefore get relief. So in this particular case, it's not complicated, you know. Even people who don't know what they're doing will still get a good change if they do a good general treatment. But the idea we want to try and develop is a good awareness of what's happening so we can definitely know that we're making a difference. The second point I'm going to mention is a more difficult type of patient that comes in. So I'll represent it by X plus Y, same joint, same muscle problem as before. This time they're complicated a little bit. Okay, maybe just to make it really, really obvious, okay, plus uv over t plus m equals z. So this patient comes in to see us. I don't need that. They are presenting with exactly the same pain that patient 1 presented with. So for all intensive purposes, both of them have low back pain. Now this time, there's many more components that we don't know about that are presenting. So let's say we have a joint, we have a muscle. They're complicated together in a tricky little pattern because maybe the liver or some other organ is dysfunctional, and that's sending signals to the spinal cord, which is reflexly contracting the muscles and joints in that area, creating a tricky pattern. Maybe they have some emotional problems at home. Maybe they're suffering from marital difficulties. Okay, complicated by some dietary issues, and then maybe they're participating in sport and they have faulty technique. So obviously in this case, we're not going to get the same results in treatment as we are going to with this case. If we just take the approach, oh, I'll just rub and crack everything, what will actually happen is it's like a tangled fishing line. Sometimes you just want to get into it and tear it apart, but sometimes it just makes the knot even tighter. So in this type of patient, we can't just do a generalised treatment and hope it works. We have to actually take out the components. So let's say we refer them to a sporting physician or a sports trainer. They address the technique component. We balance that side of the equation out. Let's say we send them off to a nutritionist or a dietitian to take out the dietary component. Starting to get a bit easier, the patient's improving. Let's say we refer them to a good counsellor, for example, or we recommend a good book about marital issues or psychology, and they learn from that and they start to get more balanced. So that'll erase that component. Then if we know how with our own treatment, we may be able to, through an awareness of the anatomy and the components, address this complicated little pattern involving the organs and the ligaments and the muscles and joints and so on, and erase all of that, like so. And then, because there's no equation left, there's no pain. So we get back to a clear slate. Now, these patients are often classified as chronic patients, but in actual fact, they're not chronic, they're just complicated. I like these patients because when they come in, they might have had a history of, say, 15, 20 years of treatment, and they're getting nowhere in the long run. And because they're generally healthy and it's just a complicated pattern, by addressing the whole pattern, they respond as quickly as these people. These are your miracle cases, the ones that get better in 1 or 2 treatments, because you know what's happening and you erase the whole pattern. So that's not a true chronic patient. I call them complicated equations. Now, the next point, I'll just rub these off for the moment, so I have room to write up the third point. Point 3. These ones are your true chronic patients, and it doesn't matter how good a physician we are, they can take time and education to help them improve. And I'll show you why. Let's say I write up a bit like a stack of pancakes here. Okay. We'll do one more layer, and then underneath I'll do a little sun representing health. Because fundamentally, underlying all problems is health. It's just that it's like throwing a garbage dump of disease over the top of health. So the health obscured and the light within is muffled so it can't express. So if I then write out here x plus y over r plus uv over 2 equals z, then x plus y equals z, and then blah, 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 you start to see that these are multiple equations on the whiteboard of health. Okay? So each time the patient presents, what we will do, the body will present an equation, a series of components that we need to address to get them balanced for now. That doesn't mean they're suddenly healthy, but one layer's gone. They go away, the body heals, they start to adapt. The next time they come in, they might present with another equation. It actually is a simple one this time, so it's relatively easy to deal with. And the next time they come in, you deal with another equation, and then another equation, and all of a sudden, meanwhile, health's a bit like, I don't know if you've seen this analogy before. Here is a flower. Here is a little weed. Patient comes in at 20% health, okay? Each treatment, you're lifting health, lifting health, lifting health. Patient gets to 49% health. They think, I'm tired of you, I'm going to go see another practitioner, we're not getting anywhere. But the tissues have been improving the whole time. The patterns should never be the same twice if we're treating correctly. If you have a patient and you've been seeing them for years and they're exactly the same now as they were then, we're not actually addressing the right problems. Then this patient goes to see another practitioner, tips them over the hill, so they're 51% healthy. They're moving forward easier than they're going backwards. It's an uphill battle to that point. So by feeding the health grows. As the health grows, we starve the weed and the dysfunctions get less. The body gets healthier and healthier. And therefore, eventually, the person gets to a point where they're able to self-heal. Their vitality levels are such that they won't get as many dysfunctions. We're offloading the problem. Another way of looking at this is like a tangled fishing line, okay? If you imagine health represented by a nice straight fishing line, but a chronic disease is just, a simple disease is one knot. A complicated disease might be a whole heap of knots clumped together, and the real chronic problems might be heaps and heaps and heaps and heaps and heaps of knots. So where do you start to unravel the knot? Very, very easy. Here's our tangled fishing line. You have two choices. Start with health at each end. Health. Here is your primary ART. Here's health. When you want to unravel a fishing line, start at the end of the string. Health flows in, hits the first problem, presents the first equation, unravel that. It then goes to the next problem, the next problem, the next problem, and then you have a nice healthy string. The only other option, if it's really too bad, is surgery. But the trouble with that is you cut the knot out and you have a shorter piece of string. So that's just a few ways to think about health and dysfunction and chronic illness. And that is why chronic patients, to really help chronic patients, we need more practitioners who are able to deal with the equations and not just do a rub and crack or general treatment and hope the hell that it works. Okay? The other analogy is like mowing the lawn. You can mow the lawn and make everything look neat, but when it's full of weeds, you might have to uproot the weeds and then plant healthy seeds instead. So we want to really help, we need to actually start thinking about how to improve chronic health, and these analogies work really well.